All right, let me go ahead and share my screen. And Mary, would you mind if people continue to pop up, letting them into the, I don't know, actually, let me make you co-host. Hold on one second. Just realized that. All right.
Are you going to be able to share the slides afterwards so we don't have to take notes or how?
Yeah, definitely. And
Thank
actually, we'll also be sending a follow-up email with the recording and like highlights. So no worries, we got you. I know how it is to have to try and take notes and listen at the same time. All right. So, can you all see my screen? Oop, guess I should go to the beginning. All right. Thumbs up. All right, perfect. Awesome. All right. Thank you everyone for coming today to today's webinar. My name is Brianna Acosta, and I am one of the project managers here at Vital Connections. We are going to talk today about one of Vital Connections' initiatives called Community Health Hubs. And of course, as you see here, this webinar is designed for current or new potential partners for this initiative. Just an overview of what we're going to be doing today. We already did the welcome. Then I'm going to tell you a little bit about who Vital Connections is as an organization, for those of you that may not be familiar with us or our work. Then I'll take you through kind of a history and purpose of the Community Health Hubs initiative specifically. And then, of course, we'll talk about why we're here today, which is our current call for 2025 Community Health Hub partners. And then, of course, at the end, we'll have time for Q&A. But feel free also, if you have a dying question that you don't want to forget, feel free to unmute and interrupt me. Totally okay. All right.
All right.
Yes. All right, perfect. So Vital Connections is a community-led systems change organization that's designed to advance health equity. So here at Vital Connections, you may see it's spelled weird, but the key word in our name is connections. And that's because we believe that, really the driving force of social change are connections, whether those be relationships between neighbors, community members, organizations, or sectors. We really believe, yes, if you could mute yourself, please, during the webinar, that'd be great. We really believe that those are what it takes to really make lasting change. And so here at Vital Connections, we like to talk about the Boston Paradox, or what we call the Boston Paradox, which refers to the fact that Boston is a city that, of course, we all know is very rich in community-based organizations, in activism, and of course, our world-class healthcare that is here. But unfortunately, we, like many other cities across the nation, still are grappling with a lot of health inequities, especially by race and income. And so we really just want to recognize that, of course, that's the result of historical disinvestment and structural racism. And the product is, of course, a community health ecosystem that is fragmented, siloed, and often not accessible to those who need it most. So we see this paradox as an opportunity. And for us, the solution for this is to be able to kind of bring everyone together, as I was saying, across sectors, across neighborhoods, and really partner with communities to co-create a more equitable, effective, and efficient community health ecosystem. And when we say efficient, we always like to clarify that by efficient, we mean taking the amazing resources and assets that already exist in our city across the different communities and getting them into the hands of people who need them most. So for us, that's really how we define it. And we think that is important to, of course, not reinvent the wheel, but to make sure we're utilizing everything at our disposal. All right. So while we did begin in the food access space, we have developed into other areas, following again the lead of community members who have expressed what they need and want. And one of those areas is the community health hubs, or what we like to call community health hubs. So this initiative began during the pandemic, during the height of it, when people were having trouble accessing testing, vaccines, once those became available. And specifically, we were noticing gaps, a lot of gaps along the Blue Hill Avenue corridor. And so that's what led us to partner with the Muse in Grove Hall to bring these tests, these COVID tests, this PPE, the COVID vaccines, and other resources to this space. Now, this was a space that may not be a traditional health oriented space, you might think, but it was a trusted community space where people were already going for other things. And so that is why we decided to partner with them. Over time, of course, people expressed different additional health and social needs. And of course, we responded with, additional service offerings. And those included things like food distributions, SNAP enrollment support, blood pressure checks, and others. And then we eventually expanded as well to all Dorchester Sports and Leadership in Fields Corner, and then eventually expanding to more sites, which I will talk about in a second. All right, so what is our model? The Community Health Hub model is really designed to be a one-stop shop for diverse health and social needs. We really want this to be accessible, so we make sure to put it in physical sites in the community that, like I mentioned, are already frequented by people and are very much trusted by their community. And like I said, they don't have to be something that's necessarily already providing health or social services. And the important difference, I think, between like a typical health fair and the community health hubs is that unlike a health fair, these are not a one-off event. We really want them to be consistent over a series of weeks and months in these communities. So that way they have kind of a reliable place to go for these needs. And in terms of kind of our long-term vision, we would really love for these to be able to become permanent assets in the community. Like right now, they're bringing together different assets across the city into these local spaces. But we would love for the hub itself to eventually become an asset, a permanent asset in each community. So that's kind of our vision and model. And then after we kind of initially started, as I said, with kind of COVID-oriented resources, obviously the pandemic kind of evolved over time and people were expressing that they really didn't need as many COVID resources anymore. They needed other things. And so we partnered with the Boston Public Health Commission to survey community members about what is it that they exactly need. So we did a community forum with over 75 community members, and together we came up with, or they came up with 4 pillars of health and wellness that really became the anchor of our new community health model, health hub model. So those are, as you can see here, food access and nutrition, stress management and mental wellness, safe movement and fitness, and then clinical care with a focus on cardiometabolic health, but we're pretty flexible on that. It doesn't, have to be very explicitly cardiometabolic health. All right, so then in 2024, last year, we relaunched the health hubs with this new model of the 4 pillars. And as you can see here, these are some of the example offerings that we had during our 2024 round. And we always made sure that each instance of the hub had all 4 pillars represented because it was really important for us to, listen to community and not necessarily prioritize one over the other. Simultaneously, while we were running our 2024 hubs, we actually also engaged in what we call community wellness convenings. So this was done in partnership with the Brigham and Women's Leadership in Health Equity Pathway, and we received funding by the Blue Cross Blue Shield of Massachusetts Foundation to do this. So what it was is we essentially, again, following our philosophy, convened cross-sector stakeholders and community leaders to really explore what are the challenges when it comes to community wellness, and as well as, of course, identify actionable solutions. So what came out of that were several things, but overall, we had a shared definition that we developed around community wellness. What does that mean to the community? And you can see it here. I mean, some things to highlight here are, of course, the holistic approach to health and wellness, not just physical health, that we traditionally think of in Western medicine. But really making sure to integrate all pieces of what it means to be human and seeing that as affecting someone's well-being. Also, I think here it obviously really calls out community agency and autonomy and kind of highlighting that we need to take leadership from the community and really listen to them in terms of what they need, trust them to use, as it says here, the resources in the way that they know best and not try and, control that. And also giving them meaningful influence in decision making. So giving them leadership positions, which is another core tenet of our model here at Vital Connections. And then definitely in terms of equitable access, making sure we meet people where they're at, not just metaphorically, but literally, which is why we bring community health hubs to trusted community spaces, again, where people are already, already frequenting for whatever reason. The other thing that I would like to highlight here is, of course, like none of this can happen without everyone being involved. So really taking an ecosystem approach to this, which is what we try and do with our health hubs, really bringing everyone together at the same table. And of course, that also comes with kind of shifting our mindset from more of an individualistic health behavior perspective in terms of why health inequities exist, more towards a collective kind of investment in systems and practices and policies that lend themselves to people being well. All right. Here we go. So for the 2025 model, which is being launched this month, we are focusing on the neighborhoods you see here. Most of these neighborhoods are, of course, in the southern part of Boston. We're particularly interested in welcoming host sites that are in Roxbury and Mattapan, because that's where a lot of our work takes place. And while we are launching this month, this is a rolling initiative. So we're planning on continuing on through the fall, possibly winter. We would love to be able to, be able to do the winter within more indoor sites. As we all know, winter can get a little nasty outside. And with that said, it'll be partners being accepted on a rolling basis. So first come, first serve. Host sites are obviously chronologically what need to be established first, and then, the headliner and the vendors, which I'll explain in a second. So changes from previous years are our new interactive headliner series. So this is a new part of our model that we decided to bring in, again, being responsive to the community wellness convenings that we had and the community forum that we heard from community members at. And this was really in response to community members feeling like in the past, they're going to the hubs to receive something or multiple things. But we really wanted to shift that more to them feeling like they're coming to participate in something. And that was really geared toward, building community over or around the hub, not only with or between neighbors and community members, but we want them to feel like they're building relationships as well with these service providers, because the higher quality relationships they have with providers, the more likely they are to be motivated and have the confidence to actually go to those sites where most of the care takes place, whether it's a hospital or other site, and actually get their needs met that way. So that's a new piece that we have, and I'll explain more about that role in a second. And then this year also, all partners will be receiving a stipend for their participation in our hubs, which is important. We really want to feel like we want everyone to feel like, their efforts and their time is being valued for sure, and that it's a mutually beneficial kind of initiative that we're all engaged in. And then another thing this year is we have our 4 pillars, which I talked about, but we are always, trying to be responsive to community needs and desires. And one thing that didn't necessarily fall within our pillars, but we have heard everywhere from different community members that it's a really needed resource, is immigrant know your rights information, especially given everything happening right now in the country. And so that's something that we're kind of reserving space for in our hubs, and we're currently pursuing partnerships to be able to try and provide that there. All right, so this is kind of the meat that you all are here for. So for 2025, we're going to have 3 different roles that partners can fulfill. So the first role, as I was mentioning, are the host sites. So this would be you or your organization having an indoor or outdoor physical space that can handle not just, a crowd of attendees, but of course have space, practical space for vendors and a headliner to exist and provide their services. So this one is going to be a commitment of 2 to 3 months in most cases, and that's because our headliner cycles run on a 6-week cycle. So typically we would have 3 months to be able to handle 2 headliners at a single spot. As I said, this is the consistency and the commitment is really being driven by community, what's best for the community. So with that said, ideally, host sites would be established for 3 months. They would receive $1,000 for those 3 months, or in the case that they can only do 6 months, and like I said, we're willing to work with you, you would receive $500 stipend. And then for the headliner, as I said, is kind of the main event. It's meant to be more interactive, something to engage people and encourage consistent attendance at the hubs over a series of weeks. So some examples are like a fitness class or yoga class. It could be a nutrition workshop or a cooking demo, things like that. And the commitment here would be up to 6 weeks. And again, this comes from wanting the consistent attendance, but we're willing to work with you. Like some headliners have already let us know, oh, well, I'm not able to do like 6 consecutive weeks, but I could do like maybe 2 or 3 of those weeks within that 6-week period. So the most important thing for us is having a headliner, whether it's the exact same organization or person, the whole 6 weeks that follows the theme. So the theme is usually, one of the pillars, whether it's mental wellness or, movement, and it could be a mixture of pillars. You don't have to fit neatly into a single pillar. And for the headliner, we'll be paying a stipend of $100 per hour. So the headliner will take place during each hub, and each hub is typically around 2 to 3 hours. So there will be 1 hour that's dedicated to the headliner, and of course the vendors can still be vending at that time, but it'll be once a week. So again, depending on how many weeks the headliner is able to commit to, that's going to be your total for the stipend. And finally, our vendors. So this is kind of the typical health fair vending that you would think of. You would have a table and you would be providing like education or chronic disease screenings or mental health support, whatever range of services and resources that fits within our 4 pillars. And for this one, the commitment would be committing to at least 4 instances of a hub. It doesn't have to be the same hub over the course of 3 months. And for that reason, the stipend will be $50 per engagement. So, each time you do one of those 4 events, your organization will receive $50. And as I said, the hubs typically last 2 to 3 hours, depending on the site. All right, I hear the chat going off, so if there are questions, feel free to either unmute or I can definitely address them at the end. All right, so for our confirmed sites, we have 2 confirmed sites so far with others pending, which is why they're not on here. So we're going to be doing a hub at Bodwin Street Health Center, which is in Dorchester, as well as at All Dorchester Sports and Leadership. So you'll see here the times and the dates. You will not, I'm not going to belabor you by literally reading all of this, but the most important thing to note is Bodwin Street Health Center has a TBD start date because we're kind of waiting on legal stuff on their end to work itself out, and we're not sure exactly when that will be. But we're thinking end of this month, beginning of next month at the very latest. And so that one will be indoors, so important to kind of keep in mind. So the headliner in this case, given just like the layout of the hub, the headliner must be a food or nutrition pillar because they will be doing their headliner segment in their community kitchen where they do kind of cooking demonstrations and whatnot. For the All Dorchester Sports and Leadership, it's a huge outdoor park area, probably lending itself best to movement headliners like a fitness class or yoga class, but we're very open to a headliner in any of the pillars. And as you can see here, they each have their main languages that their populations speak, which is an important just thing to know, of course, since we want to make everything accessible. And both sites will actually have the fresh truck already on site, which is why we chose those particular days and times to be able to host the hub. Again, making sure we're capitalizing on programming that's already happening at the sites. People are already coming for these things. So how can we just kind of build on that? I will move on for now, but we can definitely come back to this. And like I said, don't worry, we'll be sending all of this out afterwards. All right, with that said, partnership expectations. So all partners will be expected to sign partnership agreements. And of course, like I said, partners will receive a stipend for each role they fulfill. With that, I say it that way because partners can serve more than one role and will receive all of the corresponding stipends, whether that's an individual or an organization. So with that, with that stipend, partners will be responsible for, of course, hub participation, which is the main thing we're here for, according to their roles. And each role, as I was saying earlier, has a different commitment or a different, and I see a hand raise. I'll get to you in 1 second. Or do you want to unmute now?
Sorry, Brianna.
Yeah.
Hi, everyone. I'm Michelle, and nice to see you again. I have a question.
Go for it.
For the class, will it be an hour segment? Because I don't think I accessed when I met with you earlier. Or will I be there, or would the instructor be there for like the 2 to 3 hour doing like 30-minute sessions?
So it will be an hour segment, and
Okay,
you
got
can break up that segment however makes sense for what you're offering, and also for the, the population, the crowd. But it will be, look, for headliners, the commitment is only 1 hour within the 2 to 3 hour window that the hub will be taking place.
Okay, perfect. Thank you. And this is obviously free for the public and like
Yes,
open to anyone and everyone.
correct.
And then I have another question.
Yeah, go ahead.
If I wanted to bring like a photographer or the videographer, do they have to go through you guys, or like can I just handle that and have like waivers for people to be like, it's okay if you don't want to take photos, or you do, or photos and videos? Would that be a thing?
Yeah, my guess, and I will get back to you on this for sure, is that would be okay. Like the only thing that we would worry about is, like you said, the waivers and making sure we get people's permission, especially if there's minors there or in the pictures. But yeah, I don't see that being an issue, but I can double check for you and get back to you.
Okay, thank you. Yes, I do respect consent is important. So yes, thank you. That's
Yeah, yeah, totally. Um, Yeah, so with that said, in terms of like promotion, actually, so that's another thing that we ask of our partners, but this is very flexible. So we just ask that both partners engage in some sort of promotional activities. Now, that doesn't necessarily mean that you have to create your own flyer and then we create our own flyer. It can be a collaborative effort in terms of whatever works for that particular partnership. So we're obviously going to create our own flyers and marketing materials around this stuff. And it's totally fine if you just want to use ours and then distribute how you want. As I just said, it's open to anyone and everyone in terms of community members. Um, Everyone can come, ages, abilities, levels, and everything like that. So that's part of the agreement. And then the last thing is, of course, data sharing in terms of evaluation and reporting. So that's something that we really want to make sure, of course, that we capture the impact of these hubs. So any data that our partners are already collecting for their own grant and reporting requirements, we ask that be shared with us as well, and vice versa, we'll be sharing data with you as well. Of course, there may be exceptions to that when it comes to like maybe patient confidentiality, if it's like a clinic van that's there and whatnot. So obviously within whatever's allowed. And any questions on this stuff before
I do have a question, Brianna. Sorry, and forgive me if I missed it.
Mhm.
Going back to the roles, is Vital Connection finding, if we host, do you find a person to present, or do we have to find the person to present as well as hosting?
No, so if you're hosting, that is your sole role. We serve as the coordinating body in terms of getting a headliner, making sure, we'll serve as that central coordinating role. So you'll only be, in charge of the hosting, so to speak, making sure that there's space and, if you're able, providing tables and chairs for the vendors, but that can be done on a case-by-case basis.
Okay, thank you.
Yeah, totally. Any other questions around partnership expectations? All right, I'm gonna move on. we're actually at the end. So if you have any questions at all, we can address them right after this slide. But in terms of next steps, so just to give y'all, as I said, we will be sending out the recording of this webinar and as well as highlights in a follow-up email. And we would ask that, of course, you share that with your networks as you see fit. So this actually, the follow-up email will include a new partner interest form. And I say new because some of you in here have already filled out the partner interest form. And it's going to be different in the sense that it will be at these dates that I just went over with the All Dorchester Sports and Leadership and then the Bowdoin Street Health Center as our two confirmed sites right now. They will be added and you will be able to select your availability for those days of the weeks and times. And then that's kind of where or how we or me on the back end will play kind of Tetris, sliding you in different slots in terms of what makes sense of making sure all pillars are represented. And obviously I'll be in communication with you all about that. And then we're also planning to send out the finalized partnership agreements for your organizations to be able to review. And if it needs to go up the chain or through legal, that will, be available starting by early next week. And then of course, next steps in terms of this, if you are interested in partnering after hearing this information, we ask you to, as I said, share this recording and information with people in your networks, fill out the partner interest form. And for those who already responded to the partner interest form, you'll be receiving a separate availability only survey. That way you don't have to obviously fill out the same form twice, and then we'll just add your data to your original responses. And then of course, in terms of hosts and headliner roles, those are roles that typically are very case by case and require reviewing a lot of site specific details or headliner specific details. So in that case, I don't expect this webinar to be sufficient for those roles. So if you are thinking about doing one of those roles, feel free to email me or if you already signed up on the interest form, like I'll be emailing you to do a one-on-one meeting with me just so we can go over all of those kind of logistics type pieces. Yeah, so that is the end of our formal presentation. Now I will take down the slides and see if we have any questions.
I do have another one. I'm sorry if I missed it. I'm trying to get a kid off the school bus.
No.
Is there a maximum or minimum for each of the groups? So like I can see a yoga class, more and maybe more than 30 or 25 people depending on the instructor. Or like is there like a minimum max for each group or field you're looking for each hub?
No, like I said, we really try and capitalize on crowds that are already going to be existing, but in terms of exact numbers, those are going to highly depend on the site and what they typically have, of course, and with promotion, like what the additional crowd that will come. I will say it's very hard to predict exactly how many people we'll have for something like a headliner, especially because it's important to keep in mind that our health hub crowds are very they ebb and flow. It's not going to be like everyone arrives right as the health hub starts and then stays until the end. So it's going to be, which is why I kind of say like for headliners or something like that, you can do it as you see fit. Like if you want to start a fitness class and people just show up in the middle and join, like that's fine. Or if you want to do like more shorter iterations of it where you do repetition of the same fitness class for different groups of people, you can do it that way. We're definitely very open to whatever makes sense. But just keeping in mind, of course, like I said, like the 1 hour piece and the ebb and flow. So really thinking through like what that could look like, especially for ones more like nutrition or cooking demos or things like that, that may not lend themselves as much to like the ebb and flow.
Okay, thank you.
Yeah. Anyone else? Any questions? Yes, Emily.
Hi, so I'm here with Grace and Kateri. If we already have like programming that fits within the 4 pillars, could we be a host site and a headliner, or would it have to be an additional new headliner type program?
No, it could you could definitely fill more than one role as an organization. And if you feel like you have, if you have even some vendors that you would count as vendors, you would receive the corresponding stipends for all of those roles. We would just have to talk through, you know, what that would look like in terms of specifics and whatnot. And regardless, we would probably at the very minimum include, like we have internal across our initiatives, peer advocates around things like SNAP enrollment and like long COVID and things like that. So we would probably add those, but definitely that's possible.
Okay, thank you.
Yeah.
I have a question, Brianna, unless there's,
Yes.
is there like hands up in a queue? I don't want to step in.
No, I didn't see any other hands up, so you're good.
Okay, yeah, I'm curious to, like, my initial thought is maybe BMC being a host site. Of course, we also do the cooking classes, so that could be an option too. But I would definitely be interested to hear from you and your team if and how you envision us being a partner. You know, and also if like this location would be logistically beneficial for those you're hoping to serve. But you know, I think we're very much part of this Boston landscape. So I think it's a beautiful program and vision that you're creating. So maybe we can chat offline about it. And the other kind of question I wanted to ask was some of the programming that we already offer ongoing is virtual, and if that would, I know that's different than what you're talking about here, but if that might be something that you would want to connect on because it could be an offer to your constituents on an ongoing basis.
Yeah, so just to answer kind of quickly, but yeah, I agree, we should talk offline. I think for BMC, I was envisioning kind of headliner role, and the only reason I say that is, you know, the community health hubs are designed, like I said, to bring people to where they're already going. We're not trying quite yet. Obviously, that's like the end goal of the hubs is to make them feel motivated and comfortable and confident to be able to go to these healthcare institutions. That's the ideal. But in terms of like hosting, I think that's a little bit maybe further down the line. We can talk about like maybe warm handoffs or things like that. But in terms of BMC's role, I was thinking, yeah, a headliner specifically around like nutrition and food. Because like I said, we already have, like, at least in the case of Bodewin Street Health Center, like a community kitchen where you can do all of that. And then remind me, I'm sorry, the other question was around
Dual programming.
oh, virtual programming, yes. So yeah, it wouldn't be something, of course, that we're offering like at the hubs in terms of virtual, but one of the things, if y'all were interested, BMC could come and promote their teaching kitchen and say, we have these classes, we have, you know, this is like part of the goal of the hubs, right? To make people aware of all the resources that exist in the city. And if they're interested, they can then go and do them and whatever. So, and maybe your headliner could be, you know, talking about that too. You know, you're doing the cooking demo, but like, oh, we do more stuff like this at BMC. So I think there are several options there to be able to kind of include that and make sure people are aware of it.
Awesome. Thank you so much.
Yeah, totally. Any other questions? All right, I'm actually gonna stop spotlighting myself. Okay. Well, if no one else has any other questions, then my only reminder will be just to keep a lookout on your emails for the follow-up email with all the information we talked about today and the recording and the MOUs, depending on, I won't be mass sending out the MOUs. So if you're interested or your organization needs a head start on like looking at the language and whatnot, in terms of like the moving it up the chain and whatnot, please email me. And I mean, you all should have my email, but I will put it in the chat just in case. And it's also going to be in the follow-up email. Vital connections. And then we have my other or my colleague Mary here, who's in charge of our other half of what we do here at Vital Connections. So if you're interested in like maternal health equity, mental health equity, as well as, our community convos, which, Gabby participated in and some of you have participated in, feel free to reach out to me as well, and I can pass you on to Mary. She's a great contact for any of those initiatives as well. All right. Thank you so much, everyone. I hope you enjoy the rest of this beautiful day.
Thank you, Brianna. I'll be setting the meeting with you. I have some extra questions. My mind went wandering in events. Okay.
Yes, sounds good.
All right.
All right. Thank you.
Good job. Bye, y'all.
Bye.